Welcome everybody, and thank you for joining us here today. Greater Manchester is achieving pioneering things in medical imaging. The people here today are involved in the deployment of one of the largest medical imaging infrastructures in the NHS and possibly the world. But it's not about a technology deployment, nor is it about delivering a PACS. It's about transforming the way that clinicians and multidisciplinary teams come together around a patient in a way that has never previously been possible. From a patient perspective, the system is providing access to scarce expertise at a time when it has never been needed more. And Sectra are really proud to be part of this groundbreaking initiative. And over the next 30 to 40 minutes, we are going to hear from some of the key stakeholders that were crucial to the delivery of this vision. Please do reach out if you would like to be part of this conversation. So we've got a fabulous panel of speakers here today, and I'd like to take a brief moment to introduce them. First of all, we've got Dr. Rydian Bramley, Clinical Lead for Diagnostics, Digital and Innovation, Greater Manchester Cancer. He's also a consultant radiologist at the Christie NHS Foundation Trust. Next, we've got Dr. Rizwan Malik, Divisional Medical Director at the Bolton NHS Foundation Trust. We've also got Chris Slight, Programme Director for Greater Manchester Imaging Network and Greater Manchester Programme Director for Diagnostics. We've got Elaine Quick, GM PACS Implementation Lead. And finally, we've got Jane Rendell, Managing Director for Sectra here in the UK and Ireland. Okay, so Chris, thinking back to the start of the process with Greater Manchester, I'm just wondering why and how Greater Manchester started on this journey.
Yeah, interesting question, Chris. Obviously there was a necessity because every trust in GM was on a critical pathway to replace their PACS system. And I guess in all honesty, the initial conversations that happened amongst the directors of strategy back at that time, which is 4 or 5 years ago now, we're starting to think about doing something collaboratively, driven by the normal things, economy of scale, maybe through a single procurement. But as we started those discussions, it soon became clear that this project was not going to be simply around a PACS procurement. There was a lot of opportunity for doing something really cutting edge and really exciting and building for the future for the patients of Greater Manchester, particularly around the opportunities that artificial intelligence would bring with a state-of-the-art procurement. And as those discussions started in clinical circles as well, they soon really sort of gained momentum for that sort of project. And as the project started, we knew we wanted something really cutting edge that clinicians could use to really make a difference to patient care.
Thank you very much, Chris. And that's what it all boils down to at the end of the day, isn't it? Patient care and driving those efficiencies. Now, Rydian, if I could turn to you for a second, especially while we're talking about patient care and that clinical perspective, what do you think is the ultimate ambition of the Greater Manchester programme with a focus on the clinical side?
From a clinical side, we want to work together. We want to support our care pathways across the whole system, all the way through from referral, primary care, secondary care, and into the tertiary care centres where I work as a cancer clinician. So we want to ensure that the imaging is accessible across the whole pathway. At the moment, there are delays in processes because as patients move on, we have to transfer that information around. It's incredibly useful having the images available to everybody that needs it in that pathway at the point of care. And that's one of the primary objectives, is to have that single view across Manchester. Once we have that, it enables a whole wider swathe of transformation that we're looking at, which includes looking at cross-enterprise ordering of tests, scheduling, working together, disparate services across Manchester coming together and having common work lists, common diaries to book patients in, removing any inequalities in the system. And that's what we're working towards. And then, as I'm a radiologist, I report the scans, is that we can have pooled reporting and have, address areas where we've got insufficient capacity in the system and move it around to provide a more seamless, a faster and a higher quality service for our patients. The other thing to pick up on is Chris's point here on artificial intelligence, and that was a big large strategic aim for us from the outset. And by having a modern platform and integrating this artificial intelligence decision support, we're hoping that can be an extra pair of eyes that can look at these scans being done and fast track them, move them up the lists, and also enable us to do proper quality control on some of our work. So it's very exciting times.
It is exciting times, that's for sure. And it almost sounds like a virtual diagnostics department, if you will, spread across all of those stakeholders within the Greater Manchester region. It's very, very exciting for patients and clinicians alike. So, Dr. Malik, we've heard from Chris and Ridian regards to why you're doing what you do. What are the objectives of Greater Manchester? But of course, it's not as easy as making the decision and moving forward. There's a procurement process that needs to happen, and obviously that's something that you've been integral to throughout the entire process. I wonder, Dr. Malik, if you could tell us maybe some of the lessons that you learned during that process.
So that, I think, is an excellent question, Chris, and something which, as you know, has been really at the heart of what we've tried to do and important to me in the way we've gone about it. I'll start off with the old mantra that if you do what you've always done, you're going to get what you always get. So for the purposes of engaging with supplier communities going towards a contract, yes, there's a formal procurement process. What I would suggest is the hard work actually starts before, in the due diligence and horizon scanning stage, because once you formally start a procurement, you get embedded in some very stringent sets of rules which limit what dialogue you can have, what rabbit holes you can chase yourself down. And what you really want to do is have free and open conversations, be at liberty to explore unencumbered, so that you can actually work up the sets of criteria that you want to actually procure against. And that, I think, is what we as a region did well. We spent at least 2 years before we started the formal procurement just trying to do a horizon scan, understanding the landscape, and even amongst ourselves having an internal discussion of what it is we wanted to achieve, what our vision was. And so then we could go out to suppliers and discuss the vision, not just we want a product, can you supply it to us?
Absolutely, and I must say, Dr. Malik, something that struck me throughout the Greater Manchester procurement process was just how open to ideas and our experiences that the consortium were. So that was a fabulous experience from Sectra's perspective as well. I guess at this point, I'd really like to turn to Jane Rendell and ask, how can you learn from suppliers during the procurement?
Well, thanks, Chris. Yeah, I mean, it's really important to work collaboratively with suppliers. And I think in terms of the supplier community, we have a great deal of experience working alongside a number of large procurements of this type. So we do have something to bring to the party, as it were. In terms of the customer being open-minded and being able and willing to enter into that dialogue with the supplier, not having a preconceived idea of what the solution might be, more presenting the problems and the issues that they're facing and working with the supplier through sort of prolonged and detailed dialogue in order to try and solve those problems in the best possible way. Completely new ideas, can come up through that level of collaboration.
Yeah, and I think some of our best solutions that we have out there have come through that exact process, Jane. So it's good that we've gone down that avenue with Greater Manchester for sure.
Absolutely. I think our customers can inspire us equally as we aim to inspire and help drive our customers, help develop their ideas and take those forward.
So Rizwan, just hearing from Jane there about how together we came up with a solution, do you think that lends itself to working in closer partnership post-procurement, giving ourselves better alignment between what you guys want as a region compared to what Sectra are able to deliver?
I think it was vital, because it set from the outset a key understanding of what the expectations were for us. If we go back to how we had the dialogue, even during the formal procurement processes, for example, they weren't, all a list of yes, no questions. Can you do this? Can you do that? What we tried to do was set out a storyboard narrative and invited domain experts to feed back to us and say how they propose to fulfill that vision on our behalf. And I think by doing that, both Sectra and Greater Manchester reached a shared understanding of just what it is we hope to achieve and how you could fulfill that ambition, and equally how we could work together in pushing some of the boundaries and innovation. Because again, I suppose what I would say from the outset is if you start the procurement process and the supplier community isn't either excited or anxious or downright frightened by what you're pitching to them, then you're doing something very wrong. And actually, you're going to get quite a staid, boring, limited outcome. If you can raise some cold sweat right at the outset, because I think that will excite both parties. It means you can get your teeth into a problem, you can work together. And the most important bit of it is it should be a dialogue. It shouldn't, for example, be, this is what we want to do, can you do it? What we really enjoyed was a number of times we proposed something and the pushback from Sectra was, well, sure, if you want that, we can do it. But actually, why don't we do things differently? We propose doing it in a certain different way. We can look at this in this manner. And actually, that was key. Having a set of ambitions from the outset and seeing those evolve during the course of the discussions was really important. And I think it's a key to the way we're working together now.
And long may that dialogue continue, Rizwan, right the way through into deployment, business as usual, and what the future holds for Greater Manchester. I think we're on an interesting journey, and I'm looking forward to taking it with you guys.
Quite agree.
So, Chris, if I could turn to you again for a moment. You set out a very fast implementation programme for all 8 trusts in around 12 to 18 months, and you did this during one of the most pressured times that the NHS has ever seen during the global pandemic. Why did you decide to continue with what you have described as an aggressive programme during this time?
I think it's worth understanding a bit about the journey of the whole program, Chris. So when we started this journey, I was a member of what was then a procurement board, and I moved roles myself and became managing director of diagnostics within the Northern Care Alliance. So in my previous strategic role, I became more operational, still had a seat on the board, but in that role, I then co-chaired the procurement board. And as we completed the procurement phase and we wanted to move into implementation, I had the opportunity to move roles again and became the program director for the clinical shared services transformation programs across Greater Manchester. And 2 things happened simultaneously at that time. The procurement was complete, and obviously we signed contracts with Sectra, and we moved the board into an implementation. And the other thing that happened, of course, was the global pandemic hit us. And I'd taken responsibility for 5 transformation programs across radiology, pathology, and pharmacy in Greater Manchester at that time. And as we moved into that management of the pandemic, one of the things I was asked to do was to set up staff testing to implement a Greater Manchester imaging cell, which became the Greater Manchester Imaging Network. So we had to stand other things down that we really did need to do. And such was the importance that I personally placed on this programme. I convinced our Provider Federation Board that not only was the implementation of the system critical for the replacement of an aging PACS system, but the benefits that this system could offer us in radiology terms, imaging terms, in recovering from the pandemic and helping with backlogs, particularly around cancer, was going to be absolutely critical and essential. So while I was under pressure to stand programs down, this was something I was particularly passionate about, for not just continuing with, but accelerating at pace, because it was recognised immediately that we entered a pandemic, that imaging was going to be absolutely pivotal to recovering from the pandemic, as well as managing patients, obviously. So it was the criticality of it, Chris, that drove the persistence and the aggressive timescale that we wanted to roll out to really realise the benefits that this system undoubtedly provides as soon as we possibly could.
And great that you were able to do so, Chris. I mean, I think it really needs such committed and dedicated stakeholders such as yourself and your colleagues to keep these things on track and remember what that end goal is. So we're very happy to be on that journey with you through the pandemic. Also, indeed, having to do things differently during this difficult time.
And I think it's a great illustration, Chris, that this is a partnership. And we couldn't have done it without one another's help. There was the commitment from us as stakeholders, obviously, but the commitment that you provided, and you had to work differently too. You know, we know that this was new ground for Sectra. It was exciting times for everybody. But I think it really illustrates that, you know, this is a partnership. And I know that might sound blasé to say, but it really does feel like a partnership. And those early stages of working together on such an aggressive rollout, I think, just puts us in great stead for the future of both your colleagues, my companies, my colleagues, and the patients that ultimately will benefit from this system.
Okay, Elaine, so we've heard from Chris there about the strategic importance of this particular project and how critical it was to ongoing provision of service during COVID that this project went ahead. I'd just like to look to you as somebody who was then tasked with the job of deploying a project of this size. How did you manage to do it at such pace, and what are the things that you have learned in the process? What are the biggest positives from the go lives that have been delivered so far?
Okay. Well, there's no denying that it's not just an interesting project, it's a really complex project as well, because it's not just the parties that you automatically assume are involved, such as Sectra and the PACS teams. You've got IT services, the incumbent supplier, risk suppliers, breast screening services that we all had to think about, and multiply that by 8 trusts. You can see it was really complex. And although there's been some minor delays, I think what's really pushed it on has been the commitment by all parties that they want the end goal and they're really keen to work towards it. And I mean, my position's been great because I've known these PACS teams and I've found that really valuable because I could go to people I knew would help. They could come to me. They were quite happy to pick up the phone if they needed anything escalating, or they just wanted a sounding board. You know, does this sound right? And of course, within Greater Manchester, the teams themselves have worked together over a number of years. So that was a great positive. I think of the things that we've learned, I'd like to give a bit of an analogy here, that this project is a bit like having a family with lots of children. And as parents, you set off wanting that central framework, that goal. You're going to give them all the same privileges. You're going to give them all the same rules and priorities. But as each one comes along, you know there are differences. And you have to be slightly adaptable while working within that central framework. And I think that's what we're doing. And we're doing it really well. I was on site on the go live days and I took notes and I was able to pass tips on to the next trust that came along. Sometimes small points, but it helped just give them confidence. And I think the biggest positive from the go lives that I saw was watching the commitment and the great teamwork from everybody involved. Sectra, the Trust PACS teams, the wide variety of IT staff that are involved, and the clinicians. And watching that seamless move from one system to the other was great. I was in one trust and I watched the radiographers just move from the old system to Sectra PACS without hardly taking a breath between their pathway. They just did it. And I think what else has been invaluable is the help from trusts that have gone live, supporting those trusts that are coming along after them. And we're finally seeing some of the immediate benefits, such as image sharing.
true team effort, especially in such a diverse population and mix of specialties that you have in Greater Manchester. It's quite incredible, really, what's been achieved, and it's been a pleasure to be on that journey. But I mean, in amongst all of this, that we've had the COVID restrictions to deal with, and Sectra have facilitated the support and deployment activities entirely remotely throughout. I mean, who would have thought that could have been achieved? How much flexibility to the traditional type of deployment have you required?
I mean, there's no denying that trusts would have preferred on-site availability of apps specialist and the project manager. However, Sectra have provided remote training that's provided a real good degree of flexibility, which probably couldn't have happened if we'd have had those on-site set training sessions. There's also been the opportunity to record some of those remote sessions, which trusts now can use as a reflection back, bit of an aid memoir, or even in some cases, if there's been the odd consultant that hasn't been able to get training, they can use that as a training starting point. So that's been really good. And I think as we move towards the go lives and the post go lives, the flexibility with just putting those additional training sessions in if they thought they were needed, perhaps around display protocols or some admin support, and the Sectra apps team have been great to step in where they've needed to be. And again, go live and the week following go live, the app support again had to be remote, and people would have loved for them to all be on site. But being remote also had its advantages, particularly in those trusts that have got multi-site or multi-department, because unless we've invented time travel in the last few months, you know, and that specialist is where he's sat, he can't be in multiple places at once. But having that open call where people could just drop in and say, I've got a problem with this, can you change the configuration on X, Y, or Z, was really, really good. And then in the go live week, Sectra again have been really flexible about how they provided that app support. For some trusts, they've wanted a set session every day. For other trusts, it's worked to have 2 full days where people could drop in. So that has been really, really good. As I say, I'm sure trusts would have still preferred some on-site presence, because it's you get a very different feel to how you work with people face-to-face as you do remotely. But it has worked.
I'm really glad to hear that, Elaine. Very challenging, but again, I think there's things that we've done here that we'll take on to future deployments, that even in non-COVID times. But it sounds like that the feedback from the users of this new deployment style has been good. Is that fair to say?
I think that's really fair to say. I mean, whilst we're only halfway through the deployment at the moment, and some trusts are really in their infancy and getting to grips with the new system, others are really ready to explore those additional opportunities that Sectra PACS will give them, all the additional features. I say feedback's been good. A few days after one of the trusts went live, one of the consultants actually phoned me up to say he'd just reported a scan that he hadn't seen as particularly urgent, but it just so happened that the other trust's previous image was there next to it. And within doing that comparison, he realised there'd been a change that needed an urgent report, whereas previously he would have had to wait for that image to come through. So he was really over the moon about that and cannot wait for all the trusts to be on board so he can see every trust within Greater Manchester. We've had good feedback from other people as well, clinicians from outside the trust. A&E clinicians have said they're really happy with it. We've had praise for the chat facility that's been used in different ways across different trusts. System administrators have said they've seen greater visibility. If any of the acquisition staff have made errors, they can see it quickly and put it right, which they couldn't in the previous system. Improved patient privacy and access controls. And I think we're only just touching the surface with a lot of the things that we can do. And there's a great feeling that this is just the start of the benefits that they're going to get from Sectra PACS. So I think we can generally say that overall feedback's been really positive. We know there will be bumps and hiccups along the way. It's a new system. People have got to change from their normal ways of working. But overall, feedback has been really good.
So the elective backlog is now one of the biggest challenges facing the NHS. Chris, in your view, how might the imaging programme help to address this in Greater Manchester?
Yeah, so I think there's some sort of immediate and obvious things such as improved image quality and speed of transfer of images, and we've invested a lot in home working as well as part of our adopt and adapt plans in the way we've responded to COVID. But ultimately, the way we will, use this system when rollout is complete and we start using the artificial intelligence to prioritise lists for clinicians will absolutely come into its own. The way the system will allow clinicians to work not just for their own organisation, but using their specialist skills across organisational boundaries, and the speed that can happen, I see as one of the biggest benefits that this system can offer, Chris.
Thanks, Chris. And I guess you touched on it all there: speed, efficiency, better use of resources, all crucial factors when it comes to tackling that NHS waiting list, of course. But if I could turn to you for a moment, Rydian, perhaps you could tell us a little bit more about the clinical advantages of having that seamless access to the imaging.
Yes, I mean, the pandemic has been unprecedented, isn't it? We've had to cope with some very difficult situations, including non-essential staff being moved off-site. I mean, radiologists was an example of that, because we can report a lot of our scans potentially remotely. So having a system that enables us to work seamlessly off-site and with the new functionality in the system, including instant messaging, chatting, be able to communicate and establish those existing workflows with your department, albeit working remotely, has been invaluable for some sites. So it's really helped with that particular transformation. Another area where it helps is the work done looking at the whole workflow through the system. We've managed to work together as a network to make more use of the data, so we can identify where the particular problems are in the system for waiting lists, which areas do need some support. And then through the work done in parallel with the technology, which is the work done setting up the imaging network and collaborating, we can start to look at how we can support each other across the network and move that capacity and demand around to help remove the inequalities.
Indeed, and that access to specialists such as yourself can only help with the distribution of care and the diagnostic process, that's for sure. And do you think then that offers potential for identifying cancers at an earlier stage, for example?
Yes, well, I think the ways pathways can be improved, it's multifactorial. You've got to look at the whole process, and the imaging and the technology is only one bit of it, of course. But Chris touched on the artificial intelligence. If when the scans are taken, the plan is that they will immediately go through an algorithm and be prioritized, so we can identify earlier and fast track onto pathways those patients that have got significant abnormalities on their scans, in the same way that the humans do, but it's effectively helps address workforce issues and enable us to prioritize cases. So that's one element that'll help us there.
So, Dr. Malik, if I may turn to you for a moment now, I wonder if you could tell me in what other ways you've experienced MDTs being transformed, even at this early stage.
That, again, is an excellent question. Is something which is very much a hobby horse of mine, as you know, Chris. If we go back to how we used to, this is one of the problems we explicitly tried to solutionize. MDTs became an increasingly important part of what a radiologist does, but the products we were using weren't designed, because initially we were basically working with solutions that were therefore sit in front of a screen and report, not the multi-specialist engagement scenario. What this meant was that there were multiple tiers of inefficiency, and our time was also being taken away from, with air quotes, value add. What we can do already at an early stage is using multiple communication platforms within the solution is collaborate both with other radiologists and also with other specialists instantly. We can share images with them. We can share actual whole patient histories with them. And by that way, we have a more granular way of deciding which cases are more important to be discussed and how you can prioritize one case over another. Equally, the number of times previously we've wasted time by bringing cases to an MDT forum who haven't appropriately been worked up. And so we've had to revisit, and we can remove those tiers of inefficiency in what we do. There are also clearly more ancillary benefits in that because we can be more efficient in the way we report, we can get through more patient reporting, which means those patients can be brought to MDT more quickly so that we can facilitate best care at the right time and meet the appropriate national standards that we've got. Remember, what you've got in an MDT is a whole host of very scarce human resources trying to do the best for the patients in the relatively small amount of time you've got to them. So anything we can do in incremental fashion to account for that is going to be helpful. I think the other specific aspect which goes back to what we talked about, how we work together, is we set out to work with yourselves as a solution which is going to be standards-based, in which we can onboard features either within or without Sectra, which would help how we can make the MDTs more efficient and more effective. Collaboration with other tools, calendar entry, so we can assign cases to specific meetings, how we can actually manage the entire MDT journey within the product itself, or at least pass the information elegantly from within Sectra to, if we wanted to go to a third party, to do that as well. And all these facets come together to give us a more productive solution that allows us to treat patients better.
Indeed. I mean, we are all trying really hard to do so much more with so much less in today's NHS, of course, and add to the fact that our patients, if they're being discussed at MDT, are probably a little bit anxious themselves, and these are time-critical, stressful times. So anything that we can do to streamline that process to help you, as you say, those scarce clinicians and the patient are very much appreciated. And question for you now, Chris, if that's okay. Given the shortage of radiologists in the NHS, and in particular the challenges in the north of England around a high percentage of radiologists quickly approaching retirement age, how might the programme help with the challenges around recruitment and retention, and how is it enabling Greater Manchester to make better use of existing resources, I wonder?
So again, Chris, that's a really good question. I think it allows us to do this on multiple levels, really. And you know that I talk about retention and recruitment, because retention first and foremost has to be where you start with this. And I think what this does for our clinicians at the moment is offers them opportunities to work differently, and everybody, particularly as a response to the pandemic, are reconsidering their life choices now and looking at what we call work-life balance, the opportunities for clinicians to work at home, work hours that they choose, and that's hours to the benefits of patients. This system allows that. I think on another level, it shows the world that Greater Manchester is really investing in imaging, and not just for today, but for tomorrow as well. So that will help with our retention and hopefully with our recruitment as well. That we are, created indeed a Greater Manchester imaging network with a real focus on doing things differently, being at the front of cutting edge technology, and exploiting that for the best of our patients and our staff across the conurbation.
For sure. I mean, hopefully what you have there is a world-class system with world-class clinicians giving world-class treatment to the population of Greater Manchester. That's certainly something that's close to my heart, given the fact that I grew up in Greater Manchester, and my friends and family will be consumers of that healthcare system. So it's music to my ears. And
I think, Chris, when it comes to our developing workforce strategy, this system will allow us to go worldwide, to look for world-class clinicians and recruit them to Greater Manchester. In fact, that is a strategy that we've already got in train already, and this system will become internationally acclaimed, and hopefully, allow us to continue to do that.
Ridian, do you have a clinical view on the difference that this is making to staff well-being?
Yes, I've been working from home since the start of the pandemic, along with my colleagues. For those reporting this, I can do from home, and I've certainly found it very valuable. I mean, the working day was very, very constrained by the fact that you had to be in the office before. I can now work much more flexibly at any time of day. The other radiologists have found the same. And if we look at the amount of additional, or as we say, outsourced reporting that we are doing, we have all increased that to help clear the backlogs. And we found that can be done in a way that doesn't impact so much on your home life. So in terms of recruiting staff and staff well-being, it's going to be very positive, and I think it's going to help encourage people into the profession. The other area is looking for other people that can report. So as well as people outside region that can potentially do it, we're also looking at skill mix and radiographers and other staff that can be trained up to report. So it's a whole mix, and that flexibility of working and home life balance is going to be important for all of these key staff.
Dr. Malik, if we could get your perspective on this question, that would be fantastic.
Sure, happy to, Chris. So if you remember right from the outset when we started discussions, one of the key sound bites we had was site agnostic reporting, the right image to the right radiologist at the right time. And what this has allowed us to do is a number of things. The first thing is, because we've got visibility of all patient scans to all clinicians across the region, we can reduce duplication of scanning, which in itself will lend itself to more efficient working. And remember also, it's a patient safety issue. We're not unnecessarily irradiating patients because we don't need to. And because we can do this, because we can see the variable imaging strategies, we can align our patient pathways across the region to really work in a collaborative manner, something which we really couldn't do when you couldn't see what the actual workload was at an individual hospital. Sharing images in this way, as Ridian's alluded to, and also if you add in facets of home reporting, which give us more mechanisms to work in an efficient manner, in an undisturbed manner, and thereby increase throughput, is that we can also potentially have visibility to all specialists throughout the region to a unified work list. And so we can dip in and dip out and ensure that all the work is being done by the most appropriate radiologists across the region, not necessarily the one that's available to do it at any one time in any one hospital. This has the added benefit of addressing these low radiology numbers somewhat, and we can switch potentially from having to spend more money outsourcing work to setting up this insourcing service within the region, and again, which gives confidence to our clinicians that the reporting is being done by radiologists that they recognize, and that the outputs are more in line with what they want to work with for the pathways that they're dealing with.
Thank you, Dr. Malik. Now, turning quickly to the possibilities of the programme into the future. Chris, if I can come to you, the new technology you have in place opens up a range of possibilities in terms of workflow and service reconfiguration. How do you think this might enable you to redesign services for Greater Manchester?
Chris, it's going to be fundamental. It's going to be absolutely central to enable us to do this. And this is going to be, a 10-year minimum development for me. Immediately, we've got community diagnostic hubs, a national direction of travel, a very different way of working, something we're looking at in Greater Manchester to be early adopters. This technology is going to allow us to do that. Patients are going to have diagnostics outside an acute setting, much more in the future. This technology will really help in that, in getting those reports to the right clinician at the right time and getting that early diagnostics. The use of artificial intelligence in the future is going to be able to prioritize work lists, and who knows, within the lifetime of this particular project, it should enable maybe even auto reporting once we gain that confidence and clinicians are confident with those systems. So this is going to radically change the way imaging is delivered to patients across Greater Manchester.
I agree. It's a very interesting time to be in radiology and diagnostics, that's for sure. And I guess turning to you, Ridian, how do you think practically this is going to improve access and equity for patients?
Well, I think fundamentally it's going to help patient choice. They will have more places they can go, closer to home, community diagnostic hubs out in the community where they exist, easier to access, easier parking. And they can go there and they can get a high quality service, but the acquisition through this is separated from the reporting and expert advice. So they can have the scans locally and then have the expert advice from the network, because all the images will come into the same system. And through the network, this is how we're going to be working to coordinate this so the patients can be fast-tracked onto the right pathways and have the right specialist advice.
Brilliant. Thank you, Ridian. And something that Chris touched upon just previously, and something that I know that you are very, very involved in, working hard in that AI space. I just wonder if you feel that you're better positioned now to really adopt the benefits that AI brings to the clinical space.
Yes, we certainly are. The technology is the enabler. We're currently doing the work with the pathways involving the clinical leads for main cancer groups, for example, and bringing them in, making them aware and considering how we can redesign pathways taking advantage of this technology. We was talking only this week looking at automated chest x-ray reporting. We know there's a lot of GP referrals in with symptoms, especially in this post-COVID era, patients with cough. And these scans need to be looked at, and they can be automatically triaged and prioritized onto waiting lists using this technology. So we're currently working out how we can, for example, pick up incidental lesions that may be significant on these patients and fast track them into cancer pathways.
So Jane, if I could turn to you for a second, Greater Manchester have promised a really interesting vision of the future, a blueprint almost for how things can be done in the NHS moving forward. And a big part of the vision is really future-proofing that solution so that they are ready for any new challenges that are thrown at them as a diagnostic community. I wonder if you could give us some of your perspectives around the future-proofing of the Greater Manchester solution.
Yeah, absolutely. I mean, it is really exciting. The Greater Manchester project is something different. There's something special about it for sure. And it's that multi-ology, that collaboration, that desire to bring more of the information that is available, to bring that to the fingertips of clinicians and indeed patients, really, so that it really enriches that the dialogue that our customer is having with the patient, gives them that information. It stops it being siloed and unavailable and difficult to access. So, being part of that journey is important for us as well as a vendor to really understand that complexity and help unpick those bottlenecks for information and really let information flow and not be and really enhance what they're trying to deliver in terms of healthcare to their communities. There are many ways that the technology as an enabler can support the future-proofing of the GM solution. Namely artificial intelligence and the use of artificial intelligence, which I think is something that's going to be very exciting for everybody. But it needs driving, and we do see within Greater Manchester that there's a real desire and drive to use those new technologies. And what we have to do as a vendor is to give them that platform to enable Greater Manchester to seamlessly integrate those new services into the wider consortium and be able to utilize new technology, almost pull that down from a platform, just pull it down, consume, enhance the diagnostic information, and then to move on to new technologies as they're available. So we're trying to make that easy for the customer and ultimately healthcare community to consume AI.
Indeed, it's a tantalising prospect both for us as a vendor and for the clinicians and patients of Greater Manchester. And I guess leading on from that, I wonder if you have a perspective or any thoughts on ways that we could share with other regions our experience, or even other vendors for that matter.
Absolutely. So the NHS really is under an obligation to share its experiences with its colleagues elsewhere in the NHS. So I think that's important, and I know that happens, and that's a good thing. It's a positive thing. But equally, I feel the vendor community should be sharing information so that we are enriching the services that we collectively bring to the NHS. I know I personally feel very invested in the NHS, and I would hate to think that, if by lack of sharing, we were some way disadvantaging the NHS. So, yeah, I would wholeheartedly agree and participate in transparency in order to improve the services that the NHS is able to offer.
Okay, so at this stage, I think that all is left for me to do is to say thank you ever so much to our panelists that have taken the time to share their experiences, but also to the audience that have listened to our experience and the experiences of our customers. I think it's fair to say that GM have achieved such a huge amount in the time that's been available to them. Already they're seeing those clinical and operational benefits associated with the redesign of the workflows. And as much as we have shared our ideas and experiences, we would also like to hear from you. And I invite you to challenge us. We want to hear from you. Take that next step and push us as vendors to provide even more value wherever possible to you, the stakeholders within the NHS.